Hello, everybody. Most people look at a CT face scan and they see just black and white images. But what is a CT face? Okay, so it's basically a 3D X-ray of the facial bones and soft tissues used to detect fractures, infections, tumors, and even hidden pathologies that you cannot see clinically. And while it looks complicated, it becomes very simple if you follow the right system. Because the maxillofacial surgeon doesn't just see images, we see fractures, displacement, sinus involvement, even life-threatening conditions in seconds. Okay, so in this video series, I'll teach you how to read a CT face systematically, step by step, in multiple parts, so you can master it without any confusion. Whether you are a BDS student or MDS resident or a practicing surgeon, this will be the only framework you will need. Okay, so let's start from the basics. It is basically cost saving when compared to multiple views of plain film radiography. Radiation dose is far below than the threshold for cataract formation. Okay. Now, head CT should be thoroughly evaluated in a patients with multiple trauma. Search for any critical and emergent findings. Some facial injuries may compromise vision if not immediately recognized, especially orbital fracture cases. In a stable patient, CT face can be performed with little additional time when the patient is already in the scanner. Okay. Now we'll move towards the normal anatomy. What is the normal uh, uh, feature which can be seen on 3D reconstruction view of the CT face? So this is basically a 3D reconstructed photograph of a CT face. Now in this picture, what we can see? We can see the orbit. This is the area of orbit. We can see the roof of the orbit. Okay. We can see the floor of the orbit. We can see the floor of the orbit. We can see the nasal bone. Okay. We can see the mandible and so on. Okay. Now this section basically demonstrate what all the areas which can be visualized on the 3D CT face. Now we are seeing it from anterior side, so we can see the part of frontal bone here. This is the orbit again. This is roof of the orbit. This is inferior orbital rim. This is the lateral part of the orbit. This is the medial part of the orbit. Okay, this is the nasal bone. This is nasomaxillary suture where nasal bone unites with the maxilla. This is the superior orbital fissure. This is the inferior orbital fissure. Okay, this whole area is basically the maxilla. This is zygomatic bone here. We can see the mandible, we can see the ascending ramus area. This is the ascending ramus area of the mandible. If we see it from the lateral side, then we can see the coronoid process here of the mandible. We can see the condyle, we can see the ascending ramus area, we can see the angle of the mandible. This is the body of the mandible. Okay, this is the zygomatic arch, this is the zygomatic zygoma body of the zygoma. This is the temporal bone. We can see the sigmoid notch here. Okay, now if you see it from below, so below what we can see here, we can see basically the zygomatic arch here. Any kind of fracture we can easily see in this section. Okay, this is basically the mandible. This is the hard palate of the mandible. Any kind of fracture in this area also we can see on this slide. This is the pterygoid bone. This is the lateral pterygoid area. Okay, this is the medial pterygoid plate. Now let's discuss in detail. Okay, this is the basically the axial section of the CT face. Okay, now what we can see here, this is what this area, this black part is basically frontal sinus. This is basically the frontal sinus. Okay, as we know, there are two table of the frontal bone. This is basically the anterior table. This is the posterior table. Okay, now if we see any fracture, if we see any kind of fracture involving the anterior table, not involving the posterior table, then we can easily assume that in that case the dura is intact. Okay, so only the anterior table is fractured and there is no brain injury as such. Okay, now this is the orbit. This is the medial part of the orbit. We can see in this section. Okay, now in this section, what all we can observe? Now this is the orbit. This whole area is orbit. This is the optic canal. Can you see this narrow area here? This is the optic canal. Okay, this is the optic canal through which optic nerve is passing. Okay, this round object, this round soft tissue like object basically is what is globe of the orbit. This is globe of the orbit. We can see the lateral wall. We can see the medial wall. We can see the nasal bone here. This part where maxilla unites with the nasal bone. This part is basically nasomaxillary nasomaxillary suture. So you should not confuse with the fracture. This is basically the nasomaxillary suture. Okay. Now we can see the duct. Can you see this round? Can you see this round area? This is basically the nasolacrimal duct. We can see the maxillary sinus here. Any kind of collection of either blood or fluid we can easily see in this section. This is the zygomatic arch. Any kind of fracture we can also see in this section. This is basically the nasal septal area. This is the anterior wall of maxilla. Okay, this is the maxillary sinus. Okay, now let's move ahead. Now This area, this one. This is the lateral pterygoid plate. This one is the lateral pterygoid plate. This one is the medial pterygoid plate. This is the septal area. This is the maxillary sinus. These are the walls of the maxillary sinus. Okay, we can see the ramus area of the mandible. Now we'll move further ahead. So we can see the part of the hard palate here. We can also see the lateral pterygoid as well as medial pterygoid plate here. This is the nasal spine of the maxilla. So that was the axial section. Now we'll move towards the coronal section of the CT face. We'll move from the outside to inside, or anteriorly to posteriorly. Okay. This is basically the nasal bone, which is uniting with the part of the maxilla. So where both the bone which is joining here, you can see here, where both the bone is joining, this is basically the suture, which is also known as nasomaxillary suture area. So you should not confuse between the nasomaxillary suture and the nasal bone fracture. Okay. Now this is the orbit. This whole area is orbit. This is the medial wall of the orbit. This is the nasal septal. This is the hard palate. Okay. This is the frontal sinus. Okay. Now, in this section, we can see the maxillary sinus here. This is the nasal septum. This is the orbit. Again, medial wall, lateral wall. This area, this is basically the frontozygomatic suture. Okay. This is the frontozygomatic suture. We can see the various sinuses. We can see the uh, ethmoid sinus. We can see the maxillary sinus. Okay. This is the roof of the nose. Now, this area, this is basically the sphenoidal sinus. Um, this is the septum, nasal septum. We can see the pterygoid plate here. Any kind of fracture, as we know that there are various types of facial fractures like Lefoot 1, Lefoot 2, Lefoot 3, Lefoot 4, and so on. So, in case of Lefoot 1 fracture, if we divide the pterygoid plate into three parts, okay, so Lefoot 1 fracture line will pass through the inferior part of the pterygoid plate. Lefoot 2 fracture line will pass through the middle part of the pterygoid plate, and Lefoot 3 fracture line will pass through the superior part of the pterygoid plate. So we'll discuss in detail in the upcoming parts. Okay. Now we'll move towards the sagittal section. So sagittal section may we can easily visualize the temporomandibular joint area. Okay, we can easily see the temporomandibular joint area. These are the mastoid air cells. This is the coronate process. This is sigmoid notch here. This is ascending ramus here. Okay. Now this whole area is basically the maxillary sinus. This is floor of the orbit. Any kind of discontinuity or any kind of fracture in the floor of the orbit, we can easily see in this section. These are the teeth area. Okay. This is the part of maxilla here. Okay. This is the pterygoid bone. This is the pterygoid bone here. Okay. Now this sinus is basically the sphenoid sinus. This is nasal bone. Nasal bone fracture we can see in this section also. This is the hard palate of the maxilla. This is the part of the maxilla. Okay. So this was the normal normal anatomy of the CT face. In the upcoming video, I will describe in detail what are the various types of fracture or pathologies we can see in this CT face. So